Where did you come from? Where did you study? Where did you reach where you are today?
I don't believe that we have to be one or two or something like that.
But I'm sure they would like to know more about you as a person.
As long as you know what you are doing, what you want to do, and you reach that, that is enough. I strongly believe perfection is not the right thing to achieve.
I believe there's been a lot of changes since the time that
The fields are different than the time when we were growing. So when we were growing, it was more of medicine and engineering, two fields, that's it.
you should love to do what you love to do.
I am fine with that. You are the best, you show the best.
There were some traditionally allocated roles for women all along.
That's the word, traditionally allocated. If a patient is not doing well, we are more worried rather than that attitudinal difference which we have.
Women came in big numbers in the specialization that you are in.
Patients taken care of by women doctors do well. You go into orthopedics, there are women. General surgery, 70% are women, I believe. Pediatric surgery, all these fields where women were not taking care. That is really because people have changed.
How do you feel that what should be done about people getting insurance for themselves?
People have to understand that you want to stay healthy, you have to take insurance. That little amount of money you put on that will go a long way. When it is needed, it has to be done. But not for the sake of buy one, get one free.
Welcome to Conversations on HYBIZTV. I'm Suresh Kochatal. Giving birth is something very magical, and it's almost like an act of God. For doctors who have done this again and again and again, this is something that they would say is very normal for them. But for hundreds of people who pass through that door, who pass through that operation theater and see their kids being born, it's something very, very magical. And that for sure is something that we should learn from gynecologists who are based in the field. And today, I have with me somebody who's just done that, seen it, and of course is today an icon, a Padma Shri to boot, Dr. Manjula Anagani. Welcome to the show, ma'am.
Thank
Namaste.
you. Thank you, Mr. Suresh.
I know people would have now by learnt your designation because I had given that kind of introduction, a bit of it. But I'm sure they would like to know more about you as a person. And because they would like to know what you are all about. Where did you come from? Where did you study? And of course, where did you reach where you are today? And how did you reach there?
Thank you for having me on this show. This is something which I believe that conversations make the whole thing alight and many people understand what we do. So I'm a gynecologist, laparoscopic surgeon and a robotic surgeon. I head the division, clinical director and HOD at Women and Child Unit of Care Hospitals and Elite Hospitals.
Your journey started from a very small town in Andhra Pradesh.
I'm born there, but most of the time I'm completely in Hyderabad. So I would say I'm a hardcore Hyderabadi. So that is the way I put St. Anne's Vijayanagar Colony, then St. Francis in Inter, and then Gandhi Medical College, then Usmania for my post-graduation, and then practicing everything.
Dr. Manjula, this one of the main things that we see whenever we meet a doctor is that there is somebody in the family tree who's been a doctor. Sometimes it's just the parents themselves, and the children follow the kind of career that the parents have taken up. But in your case, I guess there was nothing like that. You were kind of a pioneer in your family that way.
Yeah, so I was the first lady doctor of the whole family. One of my uncle was the doctor, but we never got exposed to that, so we didn't have an idea about it. I think most of the thing, it is the curiosity which kills the cat. So it is the curiosity of my little mind when I was in 4th class, which I thought that, how am I actually talking when I think I want to talk this? How am I actually moving my hand when I want to move it? So these are the questions which my science teacher was not able to answer. But then I wanted to know more about it. That's when people said you need to be a doctor to know all this. So from that time itself, I knew I would be a doctor to know these things.
You wrote the entrance exam, and I believe you came home half an hour early, and your father was pretty upset about it. And you came 58th in the entrance exam, which is a very, very good rank. How did you achieve that?
I am fine with that. I don't believe that we have to be one or two or something like that. You are the best, you show the best, that is something. And then once you're in the top niche, that is more than enough. You don't have to be biting your nails for doing them the first, second and all. As long as you know what you are doing, what you want to do, and you reach that, that is enough. I strongly believe perfection is not the right thing to achieve because perfection is a hindrance to progress. Perfection becomes an obsession for many people. In doing so, they refrain from doing things which are more important and more needed for the world. Yeah, I look at it that way. So I believe that if your profession and your passion and your purpose of life is the same, you don't have to worry whether you're reaching that 1 or 2, 19, 19, 20 ki baat hai.
I believe your father was a perfectionist. And we know when it comes to being a perfectionist parent, you really drive your kids around the bend. Now that you are a parent yourself, when you look back and see how much of a perfectionist are you compared to, say, your dad?
And I think coming up from, like I said, when a perfectionist parent comes, there's a lot of stress which goes on into you. And we are like, why is it? I mean, at that age, we don't understand why anybody has to put so much of stress on us and all. So we believe in today's generation knows a lot. They're very intelligent. They might not know what exactly they want to do, but they do know what they don't want to do. So they're coming up the life by elimination. That is because they have a lot of choices. So I think that is a choice as a parent we should give. We should never be telling them what to do, what not to do. Give them the choice. Let them understand A, B, C, and they'll eliminate that I don't want to be C. I don't want to be B. So exposure is the thing which as a parent we should be giving now. The fields are different than the time when we were growing. So when we were growing, it was more of medicine and engineering, 2 fields. That's it. No other thing. Other things are like for losers. That is the exact sentence what people used to talk. Today, every field, everybody wins. There are only winners today. There are no losers today. Whatever you do, if you want to do, you are the best and you can achieve anything what you want to do to make you happy. So you want to do, it can be the mass media. It can be anything. We cannot even imagine in those days people opting for mass media. Very few people used to go. Then you can opt for being a DJ. I mean, in which world in our generation people thought DJ was a profession? So it's like that. So in today's generation, people want to do. Yesterday, I was talking to somebody. They said we are professional poker players. I'm like, okay, is that a profession? So there are so many professions with choices are there, and whatever profession gives them happiness, the Gen Z knows it. So I think we should give them the choice.
Yeah, I too believe in it. You should love to do what you love to do. And I guess that's a secret.
Yeah. So I believe in that. So I gave the choice to my daughter and I told her, you experiment. You want to do, when she went to do engineering there, then within first semester, she said, I don't want to do this. She went to finance, economics. And after first semester, she said, I don't want this. Then finance, finished her undergrad in finance. Then master's, she said, I don't think I want to do finance also. So business analytics. So now she's working as business analytics. She still feels this is her second best. She can still find something else which can interest her. So
yeah, apart from that, Dr. Manjula, MBBS is considered a very vanilla thing. It's just kind of an entrance exam if you ask me to get into medicine, the field of medicine. You need to specialize. For that, you need to get into postgraduate and then do something else after that. And finally, by the time you're out, what you're about 40 or 35 to 40? I mean, is this the process that every doctor goes through? I mean, this kind of specialization that is needed. I guess during maybe your time, the pressure was not so much. But today, to get into postgraduate college is a big, big challenge even now.
See, what is the things to answer that question before I would like to definitely take this point when you said that there's number of seats increased and why does it take 40 years to become somebody? I think what we need to understand is the difference which happened to our times to this time. In our times, there were 9 medical colleges, 1 quasi-government that is Siddhartha and 1 private that is Deccan. Total 10 to 11. That's it. Now we have in Telangana itself almost 60 medical colleges, Andhra another 35 medical college. What is happening to all these people who come out? No good teachers, no good teaching, so no good outcomes. When they come out, to be confident to prey on the patients, they'll have to work somewhere under somebody for a long time. When we were doing, by the time we finished our PG, we were so good that we didn't have to work under somebody to get the thing. And when you're working under somebody in a private, you don't get hands-on like the way you get in a government. So by the time you get another 7-8 years of doing whatever you want to do, you're already 28 plus 10, 35, 37, 38. You start your practice, nobody comes immediately. So by the time you actually do something, it's 40 years. So in my time, yes, I was very good in surgical. I strongly believe in which I advise my students or anybody who is doing medicine is, please don't do things because somebody wanted you to do that. So in your anatomy, biochemistry and physiology, that is the first steps which we do in medicine. If you like your medicine, in your general, when I say physiology, you opt for general medical subjects. If you like anatomy, opt for surgical subjects. That shows your innate ability. And if you like biochemistry, that is investigative sense, so radiology or biochemistry or something like that, pathology. So I knew I was very good in anatomy, so I knew I would be doing only surgical subjects. So by the time my MBBS is over, I was very good in general surgery, house surgery. I did everything in general surgery. But in house surgery, your reality actually strikes, where you're exposed to patients directly one-on-one. And you look around, you see women or men, they would go to only men whom they think as surgeons. That is, whether we say or not, typecasted, gender bias, everything. They feel that మీకు సర్జరీ చేయాలా, then ఎవరిని పిలుస్తారండి, సర్జన్ ఎవరు వస్తారండి? These are the questions which used to come there. And I was like, why is it so? And looked around, there were only 2 female surgeons in those times. I'm talking about late 80s and early 90s. And they were literally jobless. They were very good, but still jobless because hernia, you don't go to a female surgeon. You have GJ, you don't go to a female surgeon. Then only where women come. We know world is full of 50-50, 50% men and 50% women. If anything comes to the women, whether it is general surgical problem also, they would go to a gynecologist first. You have a breast nodule, they would go to a gynecologist. You have a hemorrhoid, you go to a gynecologist. So where is the surgery rampant in women? Is gynecology. So in gynecology, you have 2 subjects. So when you said babies, that is obstetrics. When you say other problems that comes to menstruation and every other problem is gynecology. So a lot of surgeries are there in a woman which can be done, which is minimally invasive and avoiding hysterectomies, and that is something which we need to promote. So that's when I decided I need to sit to show my prowess. Just because you're good, nobody is going to come. People have to know you're good, and that is possible only when people come for the surgeries. So I knew I would be a gynecologist. More into gynecology and laparoscopy and robotic never came that time. And then tell the people what to do, what not to do, how to avoid everything. So in house surgery, I knew I would be a gynecologist, and there I am.
Hysterectomy, I mean, I don't get the spelling correct often, but I guess that's what I can best pronounce it. But I believe you are dead against it.
Unnecessary hysterectomies. We are not saying when it is needed, it has to be done. But not for the sake of eat one, take one, get one, and buy one, get one free. You buy one chocolate, you get one thing. So you need an appendix, get your uterus also removed. Or you get your hysterectomy, get your appendix removed. This was the thing which used to go on in those days.
I believe there's been a lot of changes since the time that you had come out of college, specialized and got into the field of medicine, began practicing.
Thank God. I mean, certain times Google is a boon and a bane. So I tell people you need to read Google, but you need to know how good it is if you read it correctly under the guidance of doctor. If doctor tells you you have a problem and you need to read, you should read, use Google. But don't read it unnecessarily and start ఆపాదించుకొని ఫై అనమాట. అంటే మనకి ఉన్నాయి అని అనుకోవద్దు. Don't think that you have these diseases. But if your doctor says you have this, you have a right to know everything about that particular disease.
What kind of changes have you seen?
Of change in every field. If I take it from patient-wise, awareness has increased. Those days, awareness was literally zero. As simple as people thinking that it is useless to have a uterus once children are over, to the time now, if I remove my uterus, side effects will be there, so I don't want to get it removed. It's a huge jump. And the time when people used to think doctors give diseases if I go to them, to getting master health checkups, that is a huge difference. And people thinking that open surgeries are the best, to coming to laparoscopy and robotic to do a minimal invasive surgery, it's a huge jump again. So I would say from patient size, people understood a lot about what is best to them, what are the alternative techniques they have, and how to go to the best doctor and avoid unnecessary hysterectomies or do minimally invasive surgeries for many of the disorders which they have. From the doctor's sake, I would always say there's always technique and technology. So technique is something which we need to master ourselves more and more as the technology improves. So from open techniques to minimally invasive techniques in the form of laparoscopy, and more invasive for even urological problems or every other problem, to robotics, where we are looking at more precision, we are looking at more dexterity, and we are also looking at how to make patients more safer and comfortable for the surgeons to do the surgery and get them out back on their feet. So that in the nuclear world, when it is changing from 1980s to now, the complete joint family has become a nuclear family. So, and people who are not career oriented now have become career oriented. So you cannot afford to have lot of leave. You cannot afford to have people coming and cooking for you for a long time. So you need to jump and go for your job immediately. So there's a huge difference in the healthcare industry, in the way they look at, in the way the insurances have taken care. Negative side is also there. The costing has increased. As the technology increases, the costs are going to increase.
Which brings me to the point. It's fine with urban areas, but not so with rural areas. Insurance is still a big bugbear, even though the government does provide their own insurance schemes that has a certain basic coverage that is there. But when you look at the options that are in front of you, how do you feel that what should be done about people getting insurance for themselves and being rest assured that the treatment will be taken care of?
I think this is where even the government has been very nice to them, and then they say that everybody should take insurance. That has to go more to the awareness of the thing. People have to become insured. People in my childhood, I remember people used to be scared to get any insurance done. They used to think insurance means it's a death sentence. You know, there were times when they say we take insurance, there will be accident or something like that. So awareness has changed over time that people have come to this phase. So people have to understand that you want to stay healthy, you have to take insurance. That little amount of money you put on that will go a long way. But again, saying that you don't use it 1 year, you don't use it second year, third year they stop paying the premium. That again goes. So the awareness goes a long way. Government schemes are there, but they have their own negatives and positives. Some are covered, some are not covered. Some hospitals are covered, some hospitals are not covered. And the lag money which they have to give the hospital makes it technically difficult for the hospitals to run it. So I think more of awareness and more of next generation kids studying well and doing in MNCs, insuring them through the corporate insurances to their parents. So it goes a long way that way. So in the rural area, health checkups and health camps and free is, I don't know, personally, I feel free will never long last. And value for free is never there.
That's true.
So importance of the thing they won't understand, even if they don't pay at least 10 paisa of what it is. So I don't believe in completely free. We should make them pay little. Rest of the thing, if government gives, is also fine. But insurance is the only way for the rural area.
The problem with India, and I think the problem even with the Telugu-speaking states, is in the last decade, or maybe even 15 years, the number of medical colleges has drastically increased. But the quality seems to be suffering, which is but natural, because when the number of colleges were less, there were professors to take care of teaching. There were good professors, experienced ones, but as the number of colleges increased, the problem started with getting the right people to teach. Infrastructure is another big bear. The other day we saw the Telangana government facing a flack from the National Medical Council over the infrastructure, over the patient admittance, over the professors to teach, everything else that seems to be there. Where is the lacuna in this, doctor?
See, there is, like I said, when the infrastructure is not, there are two things. You have infrastructure, the person to use it correctly is also not there. So the infrastructure goes to dungeons. Now everything, it has to go by who is going to use it, who is going to be answerable for anything which is spoiled there. So the recurring costs of which go with the infrastructure, that is one thing. Now you need teachers. You're looking at doctors' perspective. The cost of living has increased a lot. Yes, you're giving decent amount of money, but still privatization and the private practice is going to fetch them more. So what are they going to do? Are doctors ready to teach for the same thing? Or they're ready to think of their family, their kids, so they have to earn more. It's a very dicey situation for the doctors there. And if you're looking at only teaching and then teaching, their earnings will be very less when they are compared to the other people who are doing it. Some people are really interested in teaching. So you should have that thing where you can open your medical colleges for a visiting faculty to come who are actually doing good practices outside. We don't need money. We are not telling us, because for me, my alumni is Gandhi and Usmania. In fact, when I was in care and all, I used to go, they used to call us, we used to go and show them how to do laparoscopy and to the students' PGs and all that, free of cost, and then come back. Slowly, somewhere in between, it stopped. I think it was more about how can an outside doctor can come into a government hospital and operate. Maybe some technical issues.
Mindset, yes.
Mindset may be the thing.
But you did do your webcast or telecast or whatever you want to call that.
Yeah, that we do a lot. Even now we are thinking of doing, but right now there are some, basically there are two things which are very important for any surgical field. safe surgical practices is what we say. And it doesn't come overnight, and nobody can tell in the textbook this is the safe surgical. Only when the new technology comes, when we start using, and early users are the ones who can understand this is what is most easiest way. So the trial and error which tells us which are the thing. So it is like when we start from ABCD, when we tell people can start from LMNOP. So it's like people learning from others' mistakes. So when we teach them, so it helps them understand how to be a safe surgical surgeon. And then comes the comfort of the surgeon. When we look at the ergonomics of the people, how we look at. We don't want to fall down on the patient and we damage our muscles and everything. And so whenever a new technology comes, it is for the patient, and it's sometimes very difficult for the surgeon. To learning curve is there. When somebody is already practicing for such a long time, do they have time to stop practice, go learn and come back? That's $1 million question. And nothing comes in 1 day, 2 days. They have to go properly, become a student, learn and come back, and then do it on this. So they have to have a hands-on training. You need to have a technical training, then you have to have a cadaveric training, then only you are eligible to get certified to do a new technology on the human being. But that's not exactly what is happening. Huge number game in the India. I think many patients are becoming the guinea pigs. Okay. So that should not happen. So for that, I think more and more training facilities should be applied for, and simulation labs should come, and more surgeons should give their time once in a month at least to train the people.
Dr. Manjula Anagani, just correct me if I'm wrong again here. At one time, men used to dominate the field that used to have specialized in gynecology.
Yeah, before, not now.
But over the years, I guess women came in big numbers, and now, of course, you see a lot of women in the specialization that you are in. But there were some traditionally allocated roles for women all along. Don't you agree?
That's the word, traditionally allocated. But now you see many, you go into orthopedics, there are women, many women. General surgery, 70% are women, I believe. And pediatric surgery, all these fields where women were not taking it is there. That is really because people have changed. They understood. A lot of studies also have proven that patients taken care of by women doctors do well. The outcomes are good. That is because of the empathy we have and the way we take care of the patients. And if a patient is not doing well, we are more worried rather than the attitudinal difference which we have. And probably also men think there are many more ways of making money than medicine. I don't know that. I'm not the right person to say that. But probably there are many other reasons. Nobody wants to concentrate and dedicate their life to only the medicine. So, but women traditionally also are known to be more empathetic. Maternal instincts always kick in. When somebody is sick, we cannot just say that. So surgically, the skills in the fingers are also definitely there. They are more, see, when we can do that sewing business through a small needle, we can put this thread. I think they have this finesse in the fingers which they can do. And that is shown, only time showed that women are better doctors.
I agree with you that women have a natural skill. They have the empathy with them.
Innate ability.
Actually, you took the word away from me, doctor. Empathy is a word. A woman has a lot of empathy. I mean, being a mother in the first place, that is it. But today, when you look at a lot of things that having, it's not just about having to handle delivery of a baby, but something beyond it. Women have a lot of health issues apart from that. There was cervical cancer, which is a big thing, and now Government of India has got into vaccinating the girl child while they're still in school so that they don't get it when they're grown up. Now, the question obviously that would arise is, with so many modern things that are happening around, pollution, for example, is one big issue. And that again impacts women's health. How do you look at this?
Absolutely. Actually, you got the right point, which I would love to make it, because we have started a campaign called No Pop campaign. No Pop means no plastics over privates. Why did I have to do this? Because recently we started and we are trying to promote all among the doctors and people. See, when you told environment, not just the environment, the cosmetics and what food we are eating are full of dioxins. They are called endocrine disrupting chemicals. So whatever we do, we are what we eat is what everybody knows. We emanate what we eat, what we think, how we are, how stressed we are and everything. So when we are exposed to all these endocrine disrupting chemicals, they are the ones they cause completely a destruction of endocrine system. It is nothing but from thyroid to adrenals, to pancreas, to even the ovaries or the testes. So that is the reason overall what we are saying is increased incidence of endometriosis, fibroids, PCOS, endometrial cancers, thyroid disorders, even the PCOS, diabetes and everything, we have become diabetic capital. So when these things happen, again, hormonal imbalance, breast cancers have increased. So now the number one cancer is breast and not cervix. Cervix is because of infection and we started giving vaccinations, so it will come down. But breast is because of exposure to all these things. Now, when we are worried about exposure to the cosmetics and what we eat and what is in the environment, why are we not worried about the plastics which are in the sanitary napkins, which are so close to genital organs, where all these plastics can get exposed and get absorbed, leading to all these things? It took us 2 decades to understand the cause for all these increasing these things. So we need to make people more and more aware about the destruction these things are causing. So women, girls, everybody should get used to organic sanitary napkins or even menstrual cups or period panties or things which do not have bleaching powder to make the sanitary napkins white or microplastics which are there. So government has to take this initiative also to decrease the incidence. Then the vaccines come, then the testing comes.
It's all about wellness that enlists.
Yes.
When you're looking back at your career right now, and say if you're given a chance again, would you do things differently?
I would do the same things again. And only thing is that time we did not have social media so much. Social media or anything is always a double-edged sword. But I was very lucky to have media on my side where I could run columns and everything and give the idea. I would definitely maybe do more and more awareness than what we were doing in the, that time print media really helped me. But again, like I said, double-edged sword, how much of what this media is called can help, we don't know. Because again, everything has become business model and it's also quid pro quo. So I think I always strongly believe patients should not go for Zomato ratings when it comes to doctors. Doctors who are really busy do not have time to make reels. Like that sort of reels. People who are really good at their surgeries do not actually have so much of time to talk so much to the patients. People get very irritated when they say that doctor is not spending so much time. But you need to understand, if the doctor is diagnosing you in 2 minutes, that means they know it really well. They have experience of so many years to know that what your problem is. So the patients today are really not having patience. So that is what I believe. Not everybody, please let me not generalize it, because we have staunch patients who believe in us from generations, and they come back to us after 30 years, they come back to me. Everything, they have delivered and again menopausal time, they come back. So that is something which we had culturally had this. South India per se is still doctor-driven healthcare. But slowly this side of the city where we have expats coming from everywhere else who don't know the doctors, they go by these Zomato ratings of 4-star, 5-star, who talk very well, but might not be a good doctor. So I believe that people have to know from word of mouth how good the surgeon is and go to the doctor.
Before I close the conversation, the one more quick question that I have is about C-sections. People have very strong reservations about it, about the use and the misuse of C-section. What's your opinion, doctor?
Definitely, I would say that, but we have to take the second side, which people are forgetting it. Were there maternal deaths high before? Yes. We used to call it a second janma. It is to be second thing. If you go through one delivery, it's over. Now, how much of maternal mortality has come down? Why did it come down? Because of increased C-section rate. How much is the neonatal mortality now? We are saving the babies whenever fetal distress happens. That is again because of increased cesarean rates. And how much of IVFs and infertility patients are there now? How much of all these diseases are there which are not allowing them to have a normal vaginal delivery? And women are becoming more masculine, men are becoming more feminine hormonally. We have more PCOS where androgen is high, so the pelvises are becoming more android and not gynecoid. So, and average weight of the baby, it used to be 2.5. When I delivered my baby, it was 2.8. But now, average is 3.25. So we have big baby, small pelvises, precious pregnancy, higher age of maternal age with comorbidities like hypertension, diabetes and everything else which is going around, severe PRH and all these things to decrease fetal decrease and all. So why are we blaming it? It's not what we need to think about. Maybe I'm giving you the complete maybe I'm playing the devil's advocate, but I think we should look at only 2 things which are important. Healthy mother, healthy baby. We should not look at whether it is abdominal delivery or vaginal delivery.
Last question, and one of the last questions actually. I come from a state like Kerala where maternal mortality and infant mortality are under very good control from a long time, 3 centuries almost. The Rajas of the yore had invested into healthcare big time. What do you see in terms of achieving that kind of figures in the rest of the country? In fact, what we look at is that if the primary healthcare is really good, things really shape up well. And it even comes down to the basic thing like, is a mother eating well? If she's educated, she knows what to eat. So is the education the bane of it or the bone of it?
Every factor you said is true. Anemia is still the ring in India now. After 4 decades, we still talk about anemia Mukt Bharat. Why are we doing it? Like you said, we will feed everybody. If nothing is there, it's okay. It's okay to be sick. It's okay to have more bleeding. It's okay to have clots in my menstrual cycle. The woman mentality of thinking that it is not okay and I need to take care of myself. I am like oxygen to the family. So let me take the oxygen first, then I will give so that my brain is good. The time the woman thinks like that, that's when the whole family is going to be good. So that comes from literacy and education and self-health care. So I strongly believe that woman has to love herself. Self-love is very important. And everybody out there should believe in themselves and they have to be themselves.
You were awarded the Padma Shri, and I guess you possibly wouldn't have known it before, but by the time the final process started, you would have come to know. How did you manage to hold on to that secret? And were you really surprised that you were shortlisted? And finally, what was the feeling when finally that announcement came through?
Not till I think 2 days before that thing. So I think in December, there was first time when I knew that, it was shortlisted. That's when actually the butterflies started happening. So it is always been patience and patience and patience for me. So one of my patient's husband nominated. One of my patient's husband has written together, patient and their husband wrote a citation, because for us, it was always biodata, CV. We never knew what was citation. It was that, access. So I was like, what is citation? What should we write? Then they have helped me in writing it. Then it was like, for us who work in doctors who work in a corporate and all, it's like a white slate. So everything is like, it's all white, and then we have our income tax paid very, very transparently. And we were so much into the work, nothing else mattered. So when the things were sent here, I believe, for the checkup, it was so easy for the police, everybody to do a background check on a person like me, who is like, even till today, I tell you, it is so easy to know about me. Everything is there in the papers and everything. So it was so easy. And then I came to know that one of my patient's father was the one who did the background check on me. So it was easy for people to do it. And in December, when I got about this background check phone call to understand about me, my brother-in-law and everything, they said that it was in the short listed. That's when it was like, okay. Then I said, okay. Then I said, oh, yes, nahi aata. These are all things which happen, but we don't know. So in January, we had this national conference. Every year, all the medical fraternity have this national conference. And that time it was in Chennai. So I was in Chennai. I was receiving my 3rd degree, that is FICOG fellowship. So I was in the front row sitting there. And then I get a phone call from 011. And that's I was Delhi. Like, and this is beautiful lady voice who says that you have been selected by President of India. And this is, will you accept it? I was like, yes. And that's when everything went on. Then till that time, I never told, except my husband, my younger brother in December, when we told, nobody else knew about it. And one of my close friends. So then I called up my younger brother and said, please tell in my mother's side of family. Then I told my husband to tell in my my in-law side of family. And next day I came home, and till evening we were waiting and watching in the TV, because till that we are not supposed to tell. So when it came in one of the channels, one of my students called up and called. We were waiting in front of one channel, but the other channel announced it. Then she said, yeah. And it's a different thing, But with every award which we get, I think the responsibility increases, because there's a lot of expectation which comes with everything. So when we talk, when we tell something, there will be lots of scrutinization which goes. So I think we need to be more knowledgeable and do what we think is right, which is right for everybody.
Wonderful talking to you, Dr. Manjula, because from you I learned a lot today, that in terms of a women's health, in terms of a gynecologist, what really goes into it all. And surely enough, for the urban woman, it is all taken for granted. But I guess in the rural areas, there's still a lot of catching up to do. And as a gynecologist, you really have spoken at length in this interview about what this field is all about, what this specialization is all about. Even a girl child or somebody, even a male who wants to become a gynecologist tomorrow can take a lot of inspiration from these words which you spoke about in the last half an hour. Thank you. Thank you very much.
Thank you, Mr.
Thank you,
Suresh.
Jai.
A privilege to be with you.
Ladies and gentlemen, that was Dr. Manjula Anagani, a gynecologist, a mother, a professional, a counselor, and somebody who's very passionate about what she does. Because delivering a baby, as I said before at the start, is like an act of God. A doctor is looked upon as a god in India. And sure enough, she essays her role very well. Thank you for watching. Jai Hind.